Today we're going to be talking about my 5 tips to help you keep your braces clean and take care of your mouth while you're wearing braces.
Get over here.
Not right now.
Okay.
This is Dr. Tamisha Denis, and this is The Modern Smile. So let's say you just recently got your braces put on, or maybe you've been wearing your braces for a while and want to know how you can care for your teeth while you're wearing them.
How'd that sound? Uncomfortably tragic.
It is really important for you to take really good care of your teeth while you're in braces, because the brackets and the wires, they cover everything up and make it a little bit more difficult for you to maintain your teeth.
What difference does it make?
People who don't take really good care of their teeth while they're in braces, especially my teenagers.
Hold it. Where are you going?
To high school, because I'm a high school student. I'm here with my fellow students. Hey, guys.
They find that they get cavities or those ugly white spots that develop underneath where the bracket used to be.
I don't think so!
And we call those areas decalcification.
Oh, that.
If you are wearing your braces, you will not know if you're forming areas of decalcification until after the braces come off.
You know, Lieutenant, you're getting pretty good at that.
So it's really important that you care for your teeth, because those areas of decalcification cannot necessarily be whitened to match the tone of your new teeth.
We are Siamese, if you please.
So let's talk about my 5 tips to help you take care of your teeth while you're in braces to avoid cavities, areas of decalcification, and other things that happen while you're wearing your braces.
You will give the people of Earth an ideal to strive towards.
So my first tip is to get a really good toothbrush.
Beauty emanates from your lips.
If you're still using a manual toothbrush, that's okay.
To what disadvantage are you referring?
However, you might consider upgrading to an electric toothbrush. Remember, you got all these brackets and wires in your mouth, and you need a little extra help to make sure you get in all those nooks and crannies.
Are you saying that no matter what I tell you to do, you will do?
My favorite toothbrush is an Oral-B electric toothbrush. There are different grades of them. They're really cheap ones that can cost you like $30, and more expensive ones that will cost you $100.
They said I was a valued customer.
No matter how much you decide to spend, it is worth the investment, because those bristles can get into all the nooks and crannies. And certain Oral-B toothbrushes actually sell special attachments just for braces.
Oh, yes.
Tip number 2, floss. I know it's a pain in the butt, but you gotta do it.
All these years, and you haven't flossed.
Not once.
Flossing is so important. There is nothing more unattractive than somebody who wears braces and has food stuck in between their teeth.
Oh, gosh, you're like way pretty.
So it's important that you learn to floss with your braces. I'm going to give you some demonstration on how that looks to floss between your braces and some of my favorite products.
Now that I've had my face repaired, don't you just wish you could carve it again?
There are products out there specifically to floss underneath your braces. Here you can see me doing a demonstration with Superfloss, and what Superfloss has is a stiff end like a needle and thread, and it's attached to a fuzzy piece of floss. So you stick that piece between the teeth, you pull it out the other side, and then you use that fuzzy end to go between the teeth and kind of rub any plaque that's underneath the gum or any food. And then when you're done cleaning, you're going to draw it out the other side.
Just like new.
Tip number 3, carry your floss and carry your toothbrush with you wherever you go.
Did you see her?
So if you're at school, carry it in your book bag. If you're going to work, put it in your purse, put it in your whatever, your briefcase, whatever you need to, because you're gonna need that toothbrush and toothpaste and that floss with you wherever you go. Because if you're talking to people, like I said before, you don't really want food stuck in between your teeth. My next tip is you might need to get more frequent cleanings. So most people, we say they need to go to the dentist every 6 months, healthy mouths, to clean their teeth. But if you're wearing braces, you may need to visit the dentist more often.
You're right. You fulfilled your end of the bargain. Now it's my turn.
When I have a patient that I have done braces for or are getting their orthodontics done elsewhere, I usually tell them the first time they come in, it's like a test.
We don't know yet why you were putting us through this test, but I know that you'll find a way to show us.
So if they come after 6 months and their teeth looks really good, they look like they're maintaining, they don't have a lot of plaque, then I say 6 months is just fine to get your teeth cleaned.
That's what I was thinking.
But if you have a lot of plaque after 6 months, we may encourage you to come every 4 months or every 3 months.
Has anyone seen Flick?
Flick? Flick who?
And that will make it 3 times a year or 4 times a year, depending on the severity of how much plaque you build up. Now, how much plaque you build up, yes, has to do with how well you're doing with cleaning your teeth.
Please forgive me.
But it also has to do with your personal biology. So some people just build more tartar and plaque more often, and some people don't. So we have to start to see how often you need to come in to maintain your mouth so you don't have a lot of plaque buildup and gingivitis. Because what happens is when all of that food accumulates or just more plaque accumulates, your gums can get red and puffy and painful. And I find that people who are having gaps closed, their gums will kind of bunch up between the brackets, and then their gums will get really red and irritated, and it can hurt.
We are getting aggravated.
Yes, we are.
More frequent cleanings, depending on how you're doing, I highly recommend it.
Dr. Harris,
Yes?
do you concur?
Concur with what, sir?
My last tip is to start whitening while you're still in your braces. A lot of people say, oh doc, when I'm done with my braces, I want to whiten my teeth. But there is no reason why you can't do some sort of whitening while you're in braces. Now, you won't be able to do crest white strips, or you won't be able to do certain things because they won't fit over the braces.
Fresh breath's priority in my life.
But there are rinses you can use. You can use Listerine whitening, which I absolutely love, or you can use just simple hydrogen peroxide.
What?
And I love hydrogen peroxide because not only is it good to whiten the teeth slowly and steadily, but it's also very calming for the gums.
Buffy, you look awesome.
So yes, you can whiten while you're in braces. No, you cannot do professional whitening where you sit in a dental chair and they put the blue light over your teeth.
You don't want to be doing that, mate.
No, I really think I do.
But yes, there are products that you can use, mostly rinses that are beneficial to your gums as well as to your teeth, and start to gradually keep that smile nice and white. You do not have to wait till it's all over.
Roll the credits!
So those are my 5 tips to helping you care for your teeth while you're in braces the modern smile way. So I hope you enjoyed this video. If you liked it, give it a thumbs up. And if you want more information about how to care for your teeth, make sure you subscribe to our videos. Thank you for watching.